London 94.9.
Vanessa Feltz on the way at 9 o'clock. It is 12 minutes to 9, and every day around 30 Londoners suffer cardiac arrest, but survival rates across the capital are hugely variable, with the best odds at specialist centres. A BBC Inside Out investigation has found you're twice as likely to survive after a cardiac arrest if you're taken to a specialist heart attack centre rather than your local A&E. Dr. Iqbal Malik is head of the Hammersmith Heart Attack Centre. Good morning.
Morning.
What is so special about the services you provide that you don't get at normal A&Es?
I think the real benefit is that you get a large team who look at that patient and choose CT scanning, invasive heart testing, and the intensive care unit that goes along with them. So even if we don't do an intervention on every patient, what we've done is a full assessment to pick out those who will really benefit. And the classic example is when you have a heart attack, then you can just drop down with a cardiac arrest at that time. And the ECG, the tracing of the heart, may not be absolutely clear about what's going on. So if you go to a heart attack centre, you're very likely to end up with an emergency angiogram and opening up the blocked blood vessel, which makes a massive difference to your outcome. Whereas if you go to a centre which can't offer that 24/7, you may not get that treatment. So it's the whole package, really. It's the initial very fast assessment, the access to the emergency treatments that we have on line 27, but which smaller hospitals don't, and then the intensive care unit with cooling to try and help the body out as well, because that helps, and that isn't available everywhere.
Now, if you have a heart attack without leading on to and at the point at which the ambulance picks you up, you've had a heart attack but not a cardiac arrest, is it better to get to the closest A&E at least first and then go on to one of these specialist centres, or is it better to take longer time to go to a specialist centre?
Okay, that's an easy question. Thank you, Penny. And that is that if you think you're having a heart attack, you will dial 999. Do not get in your car and drive to the local A&E department, because all they will do is ship you to the heart attack centre, and you may have a cardiac arrest while you're driving up there. So any suspicion of a heart attack, London Ambulance is brilliant. Ring 999, and if it's chest pain, you think you've a heart attack, they will get to you within 8 or 9 minutes. They will assess you, and if they feel on the tracing of the heart it's a heart attack, they will ship you directly to one of the 8 London heart attack centres where you will be sorted out.
I suppose the more of these centres we have in London, the better, because there'll be less waiting time or less travelling time to get people to them. But there are 8, as I understand it. Should there be more?
No, I don't think so. I think there's no need for any more than 8. London is very well covered, and we're very lucky that in joining up with the London Ambulance Service, most patients can get access as fast as they actually need. The problem with generating more centres is that there's a large number of staff that need to be involved in a 24/7 service. So you do need a minimum number of patients driving through the door. So, for example, at the Hammersmith, we'll deal with between 400 and 500 of these sorts of patients, which means that at least every night there might be one coming in, so it's worth having the team. If you imagine that we had 20 centres, each of those will be dealing with fewer patients, and you've got a lot of staff who are on call, waiting to be called in, but might never be called in. So no, I think 8 is enough. What we need to be doing is redirecting the traffic towards those centres so those patients that benefit can get that benefit and not go to the local sort of smaller hospital.
So essentially you're saying all ambulances should just immediately, if they suspect somebody's having a heart attack, they should take them straight away to one of these specialist centres.
Yeah, and and we don't need to worry about that because that service is already in place. The ambulance crews look at the tracing of the heart and look at the patient and already make that decision. So I think that the new thing, which I think will happen within the next couple of years, is if you have a cardiac arrest, unfortunately there are some that are unsurvivable, but if you have a cardiac arrest and there's a very strong suspicion that it's a heart attack, then those ones should also be shipped directly to the heart attack centre. And it's picking those ones out which have much higher chances of survival than the average cardiac arrest that we really need to be working on.
Dr. Iqbal Malik, head of the Hammersmith Heart Attack Centre, thank you.